Good morning, I am Tan Yukin. Today I will present Chapter 12, Mental State Assessment Part 3. This chapter is organized into three main sections. 1. Aggressive Behaviors Assessment. 2. Depressive Symptoms Assessment. 3. Consciousness Level Assessment. We will examine each section systematically, concluding with overview questions to reinforce learning objectives. We begin with the assessment of aggressive behaviors. Aggressive behavior refers to acts that intentionally harm others, including physical aggression, such as hitting, kicking, pushing, biting, scratching, and throwing things, and verbal aggression. When conducting an aggression assessment, the assessor should generally ask the caregiver about the person being assessed. Common polite phrases include, "Excuse me, has Grandpa or Grandma X engaged in any hitting or verbal abuse behavior in the past month?" Or "Has Grandpa or Grandma X thrown things, screamed, or argued with anyone in the past month?" We will now examine the specific scoring criteria for aggressive behavior assessment. This scoring protocol employs a clear dichotomous assessment system with definite clinical applicability. Please ensure thorough mastery of its application. Aggressive behavior assessment results are categorized into two levels, 1 point and 0 point. 1 point. The person being assessed has not exhibited any physical or verbal aggression in the past month. 0 points. The person being assessed has exhibited physical or verbal aggression within the past month. For example, the person being assessed may have verbally abused caregivers because the food did not suit their taste or thrown their food on the floor. Important considerations for aggressive behavior assessment. 1. When conducting an assessment of aggressive behavior, it is best to ask the caregiver directly for details. If you ask the person being assessed, you should be careful to determine whether the person being assessed is concealing anything. 2. The reasons for the aggressive behavior and whether the behavior itself is dangerous or will cause danger to others are not included in the scope of the aggression assessment. 3. Some caregivers have become accustomed to the assessee's daily aggressive behavior and believe that the assessee has no malicious intent, thus determining that these behaviors do not constitute aggressive behavior. To avoid this from influencing the assessment results, assessors should pay attention to the assessee's behavior when interacting with caregivers. If conditions permit, in addition to asking the assessee and their caregivers, assessors can also ask other people who have daily contact with the assessee, such as community leaders and neighbors. We now proceed to the second crucial component, depression symptom assessment. In daily life, depressive symptoms mainly manifest as persistent low mood, self-blame, and guilt anxiety, or slow reaction, decreased interest and energy, and may even include delusions, hallucinations, suicidal thoughts or behaviors. When assessing depressive symptoms, assessors often use polite phrases such as, "Grandpa or Grandma, what are your hobbies? Do you usually participate in activities with friends? Have you recently experienced low mood anxiety or a lack of interest in anything? Are you hopeful about your current life?" We will now examine the scoring criteria for depressive symptom assessment. 1 point. The assessed individual has not experienced any depressive symptoms in the past month. The main characteristics of the assessed individual include a good mindset, a positive attitude towards life, maintaining good interpersonal relationships with family and friends, and arranging appropriate leisure and entertainment activities for themselves. 0 points. The subject has experienced depressive symptoms within the past month. The main manifestations of the subject include frequent sighing, frowning, low mood, worry and sadness, or unstable mood, large fluctuations, sometimes sad, sometimes angry, etc., and inability to control oneself, or not liking to interact with people, isolating oneself and talking to oneself, or experiencing frequent anxiety, hallucinations, delusions, etc., or having suicidal thoughts or behaviors. Key considerations for depressive symptom assessment. 1. The assessor should carefully observe the physical and mental state of the assessee on the day of assessment. Ask the caregiver in detail about the frequency of the assessee's depressive symptoms in the past month, and then assess the assessee's depressive symptoms. 2. The depressive symptoms of the subject may be caused by their family members. To dispel the concerns of the subject, when family members are present, the family members can be asked to leave before questioning the subject. 3. There are many reasons for the occurrence of depressive symptoms. When assessing depressive symptoms, it is necessary to pay attention to the living environment, education level, economic conditions, quality of life of the assessed person, as well as the words and deeds of family members, caregivers, and other people in close contact with the assessed person, and make a judgment based on a comprehensive range of information. 4. Before conducting an assessment of depressive symptoms, the assessee should be informed that the assessment involves emotional issues and asked if they are willing to cooperate in answering. Assessors should conduct the assessment of depressive symptoms with respect for the assessee's wishes. We now address the final core section of this chapter, the consciousness level assessment. Assessment of the level of consciousness of the elderly refers to the process of objectively and quantitatively judging and recording the level of alertness, clarity, and responsiveness to external stimuli in the brain function of the elderly through systematic observation and examination. When assessing consciousness level, if the person being assessed is awake, ask them questions such as Grandpa or Grandma, "What's your name?" or "How old are you?" and then observe their reaction. If the person being assessed is asleep, call out to them or gently nudge their body and then observe their reaction. Now we examine the specific scoring criteria for consciousness level assessment. This scoring system comprises 3 distinct levels. 2 points. The subject is conscious and can respond correctly to the surrounding environment without drowsiness or lethargy. This represents the optimal consciousness state. 1 point. The subject performance is consistent with all aspects of sleepiness in the consciousness level rating scale. The specific manifestations include abnormally prolonged sleep states, where the individual can be aroused but quickly returns to sleep after the cessation of stimuli. 0 points. The subject's performance is consistent with all aspects of drowsiness and coma in the consciousness level rating scale. Stupor requires intense stimulation to elicit transient responses. Coma demonstrates complete unresponsiveness to all stimuli. A critical procedural consideration for consciousness level assessment requires emphasis. If the subject responds to a painful stimulus and their state changes after the stimulus is removed, the level of consciousness should be assessed normally. If the subject does not respond to a strong, painful stimulus, the assessment can be terminated and their level of consciousness can be directly assessed as 0 points. Now let's review the key points we learned today. Please think about these 2 questions after class. Please recall when assessing the level of consciousness in older adults. First, if the elderly person is conscious, how should we ask them questions? Second, what should we do if the elderly person is sleeping? This concludes our presentation of Chapter 12 content. We extend our appreciation for your professional engagement throughout this academic session.